Okay, in closing, I wanted to show you one of the processes that we use here in our office to actually get a snapshot of the nervous system. So we have 1, 2, and then a third device over here I'm going to show you in just a minute. But we do 3 different scannings on the patient when they come in to look at how the body's responding or how the nervous system is in any given moment. So the first thing we do is a thermal scan. So we look at the temperature of the spinal cord along the spine, and it's going to show us which areas of the spine are having some, again, not too hot, not too cold, but where we're looking at for good temperature movement and communication of the nervous system. But it's also going to point out the guys that are too low or too high. And then we have the EMG, the electromyography, looking for communication of the nervous system through the muscles around the spine. This is going to give us a lot of great information of how efficient the nervous system is working and communicating. The thermal scan, I also forgot to mention this, that it's going to give us great info into organ function, okay? And then lastly, we have our HRV, which is our heart rate variability. This is great because we're looking for, at any given moment of the patient, where does the nervous system find its rest point? Okay, if you came home and you sat down on the couch, took a deep breath, and you tried to relax, where does the body go into that fight or flight or that rest, sleep, digest mode? Is it settled down and able to balance the two, or does it settle right at this teeter-totter on the higher end with the fight or flight? Some patients do come in the opposite, where they're not activating this enough, the sympathetic side enough, and they're too parasympathetic or rest dominant. Those are the guys that have been there for a really long time and really wiped out.
All right, guys, so let's talk a little bit about who can benefit from this type of scan. To be honest, we can do the scan on literally everybody. Even we're talking babies, we're talking infants. It's a little bit different when we're working on infants. We don't do all 3, we just do the thermal and the HRV. But that alone gives us a lot of great information and insight on how the babies are doing, just with how their nervous system is doing from the birth trauma. Okay, even if in the perfect world you have a great unassisted natural birth of every angle that you could possibly think of, getting through that birth canal is still a rough process for that baby and for mom's pelvis. Obviously, we know that, but a lot of times there's still a lot of upper neck stress with those babies. You'll notice that especially with babies that are having a hard time latching on either side, or if they're having a hard time holding their hand up, or they're just colicky or not very happy. So the point is, though, no matter what age you're in, infant, adolescence, childhood, teenagering, adult, I mean, all of it, the great thing is we can use this scanning technology on everybody. And it gives us just some great information, as you can see here on the bottom of the slide here. And we get a better understanding of how the nervous system functioning. It gives us really good insight of where we're at in the moment, but also gives me as a practitioner of where and how the body wants to be addressed, which is really important for the nervous system, making sure we're doing it the right way and in the right order. It allows us to track progress over time, so we can do re-eval scans and then compare them as we move along. It gives us just really good informed information and data, so we can, again, make the proper decisions at the right time. All right, let's just dive into a little bit more of the pediatrics. Okay, these are some symptoms that you might be experiencing as a parent, that you're seeing in your kids and your babies, where their nervous system actually could be having a hard time. Okay, so one big sign is, I just mentioned this last slide, but how are they latching, right? If they're having a hard time getting a good latch, a good suction. I just saw a mom just the other day where she was concerned about this, and come to find out the baby's jaw was actually a little subluxated and needed to be addressed. But some other things there, if your birth story was very traumatic, very difficult, very emotionally charged, but also that there was C-section and a lot of interventions there with forceps and vacuums and stuff like that, definitely a great idea to have your baby looked at. But that excessive crying and the colicking, lots of spit up, constipation, as a baby, they have very few jobs as a baby to have a healthy functioning body. And sleeping is definitely anything sleep related. If their nights and days are mixed, or they're just not taking good long naps and rests. If their bowels aren't moving like they need to, they're not filling up their diapers, either number 1 or number 2. Both of those are also big signs. And if there's obvious discomfort, like they just can't get comfortable and the stomach's bloated. I had another patient came in and the baby was 3 months old, really just a distended belly, and mom had been to multiple pediatricians, digestive specialists, and they're trying all these different formulas, and come to find out what I had to do is just stretch the pelvis out of the baby, open up the pelvis, and the baby released about a 20-second gas release, and immediately the baby's tummy relaxed and calmed down. So many of these cases don't have to be complicated. They're just some simple things that need to be addressed, reset, and supported, because these babies, their bodies come ready and wanting to adapt to their new world, to the new environment. They just sometimes get a little stuck in that, okay? But on the other hand, you could see here towards the bottom, if they're very stiff or even on the other end, they're very floppy. Those are another signs for that. They're hard to soothe, hard to calm down. So yeah, those are some really common things with babies. On the kids side, as they're getting older, they're starting to develop more of those motor functions. So any disassociation with, they're not very well coordinated, they fall down a lot, or maybe they're crawling in a weird pattern. As cute as it is to see them crawl in different ways and army crawl and scoot, they really should be getting on all fours and moving all fours. And if they're not doing that symmetrically, then we're going to have, there's some potential issues there as well. As kids get older, they become a lot more emotional. They're maybe more sensitive to foods. Maybe they're developing more rashes. So you can see there's a lot going on here. Bedwetting is a really common one as well. Or maybe these kids get ramped up and they don't calm down quick enough in certain situations. It's really interesting. These kids, as young as they are, even those guys can get really anxious and really worried about things. So these are just some signs of looking for your kids and babies that, again, the root foundation is actually more of a neurological nervous system dysregulation. All right, now let's close up here with some thoughts about mom. Addressing mom's issue is one of the most important things also, because and dad, okay, let's not leave dad out, but let's talk about mom specifically here. The reason I want to talk about moms is because, again, while in utero, the baby's nervous system is regulating to mom's nervous system. After the baby is born, mom still plays a big role with this. So does dad at that point. But mom's nervous system is still really integrated with that baby, okay? So these are some symptoms that, hey, moms, you might be having a dysregulated nervous system that needs to be addressed as well, okay? These are a lot of common things that I hear in my office, just on repeat. They feel like they're running on empty, can't shut their brain off, feeling overwhelmed, anxious for no reason. I'm snapping a lot more at my kids. This is a really common one where they just say things like, I don't feel like myself anymore. I don't know who I am. I've kind of lost myself, right? They're waking up tired. Their patience is thin. There's a little bit of normalcy here with kids. We have to adapt our system and processes as parents, but if this is carrying on for too long, those are some signs there. So these are the tools that we use in our office to really get a good snapshot of where are you at, but it also helps me on my end to figure out what type of treatments, how long are we looking at, and just to help set some of those expectations as far as a treatment plan goes. So that's all I have for you today. Thank you for watching, and thank you for looking into this information. If you have any questions, please contact our office, and we'll be happy to set up a free consultation, either on the phone or in person.